Alright, so I'm going to talk about what testosterone has done in effects to my body and whatnot. Of course, it changes, it goes through changes and affects everyone differently than from what it has done with me. I've been on hormones for around 2 years now, and one of the first changes that obviously happened was getting more hair just everywhere. So one of the changes that will obviously happen is getting more hair, and I do have some pictures that I'll link below for a better reference of facial hair and whatnot. But in terms of hair, you will obviously get it facially, as you can kind of see right now. Mustache and then some hair along jawline and whatnot. It's still coming in kind of crappily, so I'll have to do something to help that. Then other places are obviously your chest. You'll get chest hair, stomach hair, more hair on your legs, more on your arm, possibly thicker eyebrows, which I kind of gotta tweeze there before I get a unibrow. Of course, even back hair could be a possibility. I haven't had any experience with that yet, so hopefully that doesn't really come until later on. Won't be too big of a deal though. And then a place that no one talks about getting hair is your butt. You will get butt hair like no other, and it might be a big deal, it might not be, but you will get it there, and it could be annoying, it could be not to your liking, but that's something that needs to get talked about a lot more with hormones, is that you will get hair in places that you might not want hair to be. Of course, along with the hair, fat redistribution. So fat will more than likely go to your stomach, how it has with me, around the stomach, waist area. So if you are curvy, it will definitely fill you out some more and kind of ease that feminine hourglass that a lot of trans guys are worried about. It will definitely help there. It might take a bit, but for me, it kind of filled out rather quickly. And you will also gain more weight a lot faster as well. With hormones too, you will be hungry as hell. You will eat more than you probably have since puberty. Of course, that will help with the weight and getting a heavier set. Of course, you'll gain more muscle as well. Your muscle mass will will increase as well too. So no one's getting fat. Of course, muscle weighs more, so that will add to your weight, so don't worry about increasing in your weight. That's just because fat is moving around and your muscle mass is getting more built up than it is without hormones and with women. So that is something that definitely does happen. Don't worry about that though. You're not getting fat, don't worry. It's just something that happens. Along with other hormone effects, your voice does get deeper. It took mine quite a bit to break and drop lower. I'm still waiting for it to get lower, and I still need to kind of practice with that though. But it can take months, it can take a year, it can take 2 years. Just kind of depends on how it affects you. It doesn't happen right away. Some people it could happen right away, but with me, it didn't. It took some time, probably 6 months, close to a year, for it to start cracking and going through like a prepubescent 12-year-old boy who's just hitting puberty for the first time, and the voice is cracking and doing all sorts of weird things. So it definitely does happen. Just give it some time to wait for that to kind of take an effect. Of course, with hormones as well, you just gotta be patient. There goes my cat. You just gotta be patient with a lot of the effects, in terms that it doesn't happen right away. It doesn't happen overnight where you take a shot or gel or patch and it just boom happens the next day, because it doesn't. It does take time for it to really take an effect and toll and get into your system. Other things with hormones, of course, other than the hair and the voice dropping, everything that people are wanting to happen, there are other things that can change, such as with your mood. Since it is going, I guess, through a second puberty, your mood can take some swings in the beginning, especially right at the first part. With me, I've noticed that it kind of gave me more energy in a way. So it definitely will give you more energy, kind of boost your mood too. Of course, with starting hormones, if you had experienced depression and due to dysphoria, that will definitely ease some of your depression from affecting you as bad as it has been, since hormones are, in terms, fighting against that dysphoria to ease it and relieve you from that unnecessary pain that trans people go through. It will definitely help in that area. Of course, you can notice some mood changes and mood swings from just starting. Keep an eye on that, and if anything really kind of goes out of loop, you should probably get in touch with your doctor about that, just to make sure that everything level-wise is okay. But don't lie and say everything is fine and fear that they might take you off. Your mental health is more important than getting on hormones right away when your state cannot necessarily handle it. And then it's definitely important to let your doctor know everything in wise of things that might worry you or you never noticed before. So definitely keep that in mind. More than likely, they will not take you off of hormones. They might just lower your dosage to help kind of level it out until you can get to that state where you can get a higher dose. Additionally, with hormones, your bottom growth will definitely grow as well. That's something that not a lot of people talk about either. Bottom growth will happen. It will grow, and it will more than likely become more sensitive to you, and it might be uncomfortable or odd. It definitely is, but you will definitely get growth down there whether you want to or not. It's just something that happens with testosterone, because it's the hormone in men. Obviously, bottom growth is going to happen with that. And then additionally, your period. Mine stopped immediately after the first shot. I just got lucky where it just ceased to exist. Now, others, it could take some time for it to stop. Okay. It will stop eventually. Don't worry about that. It just takes some time for, obviously my body's different than every other trans guy's body. In terms where something started sooner, something started later, something stopped earlier, whereas sometimes the period might stop later with other guys. So it's not something to worry about that. It will stop, definitely, though, and you will not have to worry about that anymore. That annoyance is gone for hopefully good, as long as you stay on hormones and don't come off of it where it can possibly start back up again. And then in other terms with hormones, I just want to let you guys know that testosterone is not going to make you androgynous. There's no magic dosage for androgyny or a non-binary type of dosage and look. That is not something that exists with hormones. What hormones will do and what they're pretty much designed to do is give you the sex characteristics of that gender the hormones are for. So if you're not looking to become hairy, if you're not looking to for that bottom growth, if you're not looking for the fat redistribution, if you're not looking for a deeper voice, it's definitely something that you should probably want to look more into, definitely, because, you can't pick and choose what you decide for the changes to happen. You can't pick and choose those. What happens. It just comes along with the hormones. You can't, if you say you want facial hair and that's it, you can't just pick and choose that and not expect other changes to not to happen. So it's definitely not an androgyny type of medication. It doesn't do that. It will not make you kind of an in-between gender or whatnot you're ever looking for. It doesn't do that. Additionally, with hormones, they will make you a man. Other effects that have happened to me, different body odor, definitely. It more so a man smell, in terms, I guess, if you want to say that. It will make you smell like a man. And for me, that's perfect. For others, that might not be something that you're wanting. It can come with the chances of hair loss as well. I haven't noticed any hair loss or hair thinning, but that's something that could happen. And depending on genetics in your family and how your men are in your family in terms of hair loss or hair growth, that can definitely take a toll on how you might experience that transition. Additionally, of course, with all the changes that happen, it might not be something that you want to happen. So it's definitely something not to jump into. It's something you need to give time and think about, go through research, look into it, talk to therapists, talk to doctors about the changes that can happen, and what to expect when you're on hormones as well. And then additionally, also, hormones do not work as a birth control. There is still the chance of getting pregnant if you're female to male. They don't work as a birth control. However, if you are taking birth control, you will be taken off of that for the hormones to take full effect. So if you are sexually active and want to make sure that you do not get pregnant, then additional steps to prevent that would be required, because hormones are not a secondary birth control that magically makes it so you can't get pregnant anymore. It can still happen, of course, where hormones can additionally cause it to so you cannot get pregnant. So it's kind of a this can happen, that can happen type thing. Just keep in mind that if you're looking at hormones like, oh, hey, since I'm on testosterone now and my period stopped, that means I can't get pregnant anymore. There's still that possibility that you can. So take those additional steps to prevent that if you are looking to prevent that. And then just kind of the last part of this is hormones are not meant for everyone to take. I know that for a fact. I'm not doing this to be mean or to tell people that, no, you cannot take this because it's only for trans people. Hormones are not for everyone. They're designed for specific genders, such as where you get older and you might need help with testosterone. They're meant for that if you're a man. They're meant for transitioning wise too. Hormones are not a fun medication just to take out, just to try out, because some changes are irreversible. My voice, that's not gonna go back up. The facial hair and whatnot, since I've been on hormones for so long, that's not gonna go away. The hair that I've gained is not gonna go back and just fall out. Additionally, unless you have a need for them, an actual need, whereas, you're a woman who needs help with estrogen, or you're a man who needs help with testosterone, or you're transgender and transitioning, I cannot talk, that does require some form of dysphoria. If you take hormones and you don't have any dysphoria, you're perfectly fine with how you are. You're completely fine with everything and how everything is going with you, and you suddenly get on hormones, that will more than likely cause dysphoria to happen within you. So they're not meant for everyone to take. It's meant for, in the transitioning sense, it's meant to ease dysphoria, to help trans people become who they actually are supposed to be. It's not meant for a fun, I'm gonna try this, and later if I don't like it, everything will go back to normal. That's not something that does happen. This is something that most changes are permanent. It's not something for just to do because. It's to help ease dysphoria within trans people. And to ease that discomfort and distraught, and to kind of get you to a sense of belonging where you were in the body of who you were always supposed to be. So I will leave it at that for this video. It's getting kind of long. Hopefully I'll probably do more uploads today later. But that's how transitioning has affected me so far, and just some things that can happen to you. Additionally, other things can come up and happen to you, or some things might not ever happen to you. It's just dependent on how your body takes it, and as well as genetics within your family through males.